cooler this week, perhaps even a little snow in places. I'll be back later in the programme with all the details.
Good evening. There was an angry confrontation in the street today as junior doctors started a 24-hour strike, with a member of the public accusing them of spitting their dummies out. At some of our local hospitals, up to half of junior doctors are not working, meaning that hundreds of cancelled appointments and a small number of postponed operations. They've been offered an 11% rise in basic pay, but will lose extra cash for working some unsocial hours. Doctors say that patient safety is also an issue. Tonight, the government asked them to reopen talks. Here's our health correspondent, Vicky Johnson.
In Hull, Lincoln and Grimsby, as at hundreds of hospitals across the country, junior doctors walked out at 8 o'clock this morning on strike.
Patients will be harmed by an NHS that is without doctors, because if doctors are discouraged to leave the NHS and medical students are discouraged from joining medicine as a profession, then that will cause greater harm than 1, maybe even 3 days of strike action.
I'm really sorry to any patients affected by today's action. Our fight is not with you, but I'm afraid the blame for this action rests squarely with the government.
But not everyone was supportive of their action.
You're getting disgusted with yourselves. You signed and you swore a Hippocratic oath to protect people's lives, not to spit your dummy out and come out here.
Junior doctors claim contract changes will make them much worse off, as the number of hours during the working week that are classified as unsociable and therefore attracting extra payments are being cut. They're also concerned they'll be forced to work much longer without breaks. In Hull, they took to the streets to try to get the public on their side.
It's like lorry drivers. If they work too long, they cause accidents and people's lives on the line. Same with our job.
What do you think to the action?
What it needs doing, because, well, they've been exploited.
They need to get the pay rise because they do a good job, but obviously it'll have an impact on people when they're waiting for times.
They've been under pressure for years as junior doctors.
This outpatient clinic at the Eye Hospital in Hull is almost as busy as usual. Hospital bosses say they've had to cancel 178 outpatient appointments and 13 surgical procedures across their main hospital sites here, but say these will be rearranged as soon as possible. And patients at this clinic seem hardly to have noticed the strike.
I thought there'd be a delay anyway, because normally there is, isn't there? But no, it's been better than ever. We more or less thought, well, there could be trouble, you know, but there wasn't.
To be fair, it's been pretty quick so far, so it's not really done anything to hold us up.
Today's action has given some junior doctors time to reflect on their jobs and what the public think of them. They're now hoping an agreement can be reached before the next strike planned for later this month goes ahead. Vicky Johnson, BBC Look North.
Yeah, we're asking for your views on this one in just a moment. Earlier this afternoon, this is what the Health Secretary had to say.
This is a completely unnecessary dispute. We have some disagreements with the BMA over pay, but we all want to promise every patient who uses the NHS the promise of the same high-quality care every day of the week. And at the moment, we have an NHS where if you have a stroke at the weekends, you're 20% more likely to die. That can't be acceptable.
That's the Health Secretary talking earlier this afternoon. Well, Dr. Kishan Rees is a junior doctor and teaches medical undergraduates at Lincoln County Hospital. I asked him how much junior doctors earn in a year.
It really is a vast amount, depending on their level of experience. Can be between £23,000 to £24,000 when they're just starting out, right the way up to £60,000 to £70,000 the day before they're going to be a consultant.
The government say they've addressed most of your concerns. Give me one concern that you think they haven't addressed.
Well, I think patient safety has got to be at the top of the agenda. Guardians have been mentioned. These are trust-appointed positions that would safeguard junior doctors working, but they don't seem as robust as the severe financial penalties in place at the moment for trust.
But you're going to get 11% pay increase. Government say 75% of doctors will be better off. Isn't it really that you hang on. Isn't it really that you don't want to work in the evenings and at weekends?
Absolutely
Isn't that
not.
what it's about?
Definitely not. Absolutely not. We work evenings. We work weekends. junior doctors.
Well, I saw a junior doctor being interviewed on the television earlier today. He said he wanted to be at home with his wife on a Saturday. Many people want to be at home with their wife on a Saturday, but they have to work.
Well, I think if you get a Tuesday and a Wednesday off, I think that's absolutely fine, and I think many doctors think that as well. I think some of the concerns are there's junior doctors that are working 12 days in a row. So if you're working 12 days in a row, I don't think it's unreasonable to want to see your wife, girlfriend, boyfriend, whatever, in the week.
The government have a mandate for NHS care at the weekends after the election. I mean, it's generally accepted that it's not as safe to be in hospitals at weekends as it is. As it is in the week. That's generally accepted, isn't it? And
I would contest that point.
Are you not, as junior doctors, trying to stop that?
I would contest that point that it's generally accepted that it's in terms of the safety aspects at weekends, and I think there's evidence that people would contest that. Lots of people would contest that. Some of the figures in those studies are questionable, and I think we'll see more of that coming out in days and weeks to come.
OK, poll out today, Mori poll, 2/3 of the public support you. Do you think that that will continue when you have your second and third strike in February, and the third strike's going to affect A&E?
Yeah.
Public sympathy will ebb away, won't it?
Quite possibly, and yes, that is certainly a concern, and I wouldn't blame the public if public sympathy did ebb away, especially when the threat of emergency care is withdrawn. I don't know how I could handle that. I'm in education, so if I don't work, students don't get taught. There's no impact on patient safety. But if I was in that position, it would be very, very difficult to do that. And I personally hope that that's just a bargaining chip, and I hope that that will get called off as the first strike was in December.
The Health Secretary has said that the strike is completely unnecessary. Do you agree with him?
Well, the Health Secretary wouldn't be interviewed last night.
That wasn't the question. Do you agree with him? It's completely unnecessary.
Well, I disagree with him then in that respect.
Dr. Rees, very good to talk to you tonight. Thank you very much indeed. I wish you well.
Thank you.
Dr. Rees is a junior doctor talking to me earlier. I'd like your views on this one to find out what people think. Polls suggest, that Mori poll suggests that 2/3 of people in the country are in support of the junior doctors at the moment.